The fear of labour and birth. Why are women so fearful around labour and birth? Where do we get our messages from around labour and birth? And if I was to ask you, you'd be saying, well, stories we've read, conversations we've had with friends or family members or neighbours, the TV, the soaps. And the TV and the soaps either portrayed labour and birth as being traumatic or as comedy. But we don't hear about the beautiful birth stories or what worked well in labour and birth and what didn't. So if you think about how does this body respond to stress? What hormone is produced when we're stressed? So just thinking, maybe kind of going into an exam, a stressful situation that we're facing. How does the body respond? We release adrenaline. What does adrenaline do? Our heart rate goes up. My respirations are becoming more shallow. Where is my blood supply going? My blood supply is going to go to my main organs. My heart, my lung, my brain, and my adrenals. So if we apply this to labour, and I'm really stressed because I have adrenaline and I'm going into labour, my heart rate's pounding, my respirations are becoming more shallow, my muscles are becoming more tense, my blood supply is not going to go to my uterus, it's going to go to my main organs. So if I'm very stressful in labour and very tense, and if we talk about if we're very stressed, we're very fearful. If we're very fearful, we're very tense. If we're very tense, we will feel more pain. Because my blood supply is going to go to my main organs, my uterus is not a main organ. There'll be less oxygen and less blood supply going to my uterus and to my baby. So what happens in times of relaxation? My heart rate's going at the right pace, my breathing, my blood pressure. My body feels more relaxed, my muscles are more relaxed. So if I can apply some relaxation techniques to labour and birth, my uterus is going to get more oxygen, more blood supply, and so is my baby. My baby is going to be bathed in the lovely hormone, which is called oxytocin. And when we go into spontaneous labour, it's oxytocin that is released. Oxytocin is known as the hormone of love, and it's a very, very shy hormone. So when we have adrenaline kicking in, it suppresses my oxytocin. The oxytocin is going to help my uterus contract, those longitudinal muscles pushing, baby's head is pressing on the cervix, and my cervix is thinning and opening. I'm not saying you're not going to feel any pain, but you will certainly feel less. The more you relax, the more that cervix will thin and open. So the next session we're going to look at relaxation techniques for the first part of labour and birth.